I'm going to talk about acne and acne scars. Remember that perhaps the most significant problem that the youth of today face, which is the teenagers, is acne. Well, acne by itself is not much of a problem because acne comes and then acne goes. Parents come and tell me that. But that's not the whole story, because though acne is temporary, maybe for 5 years, acne scars are permanent, lasting as much as 50 years. So if you look after the acne well in the first 5 years, then you're going to have nice, good, clean skin, which is going to last for many, many years to come. And so therefore, how do you go about treating it? See, the first thing we need to know is acne has at least 4 factors running to get it up and going. The first, of course, is heredity, genetics. If parents have had acne or severe acne when they were young, the chances of their children getting it is also high. The second factor is hormones. Now, you don't talk about acne in 5-year-olds and 8-year-olds, and you don't talk of acne in 60 and 70-year-olds. So acne is something which is seen around puberty because the hormones start fluctuating, the testosterone, the estrogen, all the hormones start flowing, and then you see that the acne increases, especially during cycles. The third factor, of course, would be diet. And today, perhaps the significant culprit in causing acne is sugary foods and processed foods. When I was a teenager and I was a young dermatologist, we didn't get to see so much of acne as we get to see today, because today's diets have become significantly high in sugars and processed foods. And the fourth factor, of course, you cannot escape in this country or anywhere else, is dust. Dust needs to be seen as a source of infection on acne, and therefore 2 of these factors, of course, can't be avoided much. Genetics is there to stay with you, and so is the dusty environment, from which you have to be careful. During these 5 years of acne or 8 years of acne, you need a judicious mix of treatments. You need topical creams which contain adapalene, which contain benzoyl peroxide. You need antibiotic creams. Then you need oral antibiotics, which is minocyclines or azithromycins, to make sure that the pustular component of acne goes down. So even if it's grade 1 acne, which is low, or grade 4 acne, which is severe with nodules, they both need therapy. But if it's grade 3 or grade 4, which borders on severe acne, then we have to treat it aggressively, and we'll need lasers. What are the lasers we use? Well, one of the lasers is right on my side here, which is called the fractional CO2. The fractional carbon dioxide laser, which is the ultra pulse, is perhaps the best in the business. And this is used for acne scars, because acne scars today, when they are new and fresh, if you target them with the fractional CO2 laser, you can have a remodeling of collagen, which will be followed by very good skin. The next one, which is a new wave of therapy in the business, is right behind me, and this is called the Pico Q-switch laser, which is extremely energy dense, which penetrates the upper layer of the skin, which is actually the middle layer of the dermis, and breaks up the scar tissue, remodels the skin in such a way that the scars go down, fresh skin is laid out, which is fresh collagen, and the scar becomes soft and subtle. So we have a mix of oral, topical, and then a couple of lasers, and there are more lasers, of course, but these are the 2 which matter most. When you have acne which is aggressive, you can use this, which is the Pico fractional Q switch, and when you have scars, you can use the fractional CO2. Of course, there's another therapy which is available, which is commonly used, especially for inflammatory acne, and that is peels. We have glycolic acid and salicylic acid peels. Salicylic acid peels are for inflammatory acne, the red acne which is significant and pumped up. So you use salicylic acid, which coagulates that skin and releases the purulent material from the nodule. And then you have, of course, glycolic acid, which softens the skin, after which we have to do what's called an acne cleansing, which means we remove the blackheads, the whiteheads, drain the pus from the pimples, the nodules, and the pustular lesions. And then you see that under cover of antibiotics, the healing is brilliant, it's excellent. And of course, you have to tell the patients that this doesn't mean it's a journey of 1 month or 2 months. You will have to keep coming and address your acne issues for as long as you get acne, but mostly it's about 3 to 5 years. And if you get your treatment right, you will have very good skin to thank to the dermatologists who have treated you, and to the and to yourself, of course, for having been persistent. Because today the biggest problem for a youngster is to stay with the therapy for 3 to 5 years, which would be because most of the youngsters don't have the discipline to maintain a routine for so long. Unlike their parents who would take a lifetime of diabetic treatment or a lifetime of blood pressure treatment, you're not going to see that with acne. So stay with your doctor, stay strong in your therapeutic venture. Come to your doctor whenever you need the therapy. Go along with what he says, and rest assured that the years to come you'll be well rewarded by having taken treatment with an assortment of creams, tablets, peels and various lasers in your journey towards having very nice skin for the rest of your life.